In this video, I want to walk you through the PDF file. And in the first two videos, we talked about the superficial back line and the superficial front line, which you can see here. So now I want to give you an overview of these fascial lines and why this is really essential knowledge for acupuncturists to understand. So if you missed the first two videos on the superficial back line and superficial front line, go back and take a look at those because I talk about a number of details. So let's talk about the lateral line now. So you can see in the far right image this fascial line known as the lateral line. It looks a lot like the gallbladder meridian. And when you start to dive into the anatomy of this and understand what muscles are on these lines and how they interact together, as well as how that relates to functional anatomy, then it's going to give you a lot of insights into the traditional point functions. And this is a really important point because as acupuncturists, one thing that we need to do is to identify the best points that are going to get the patient the most optimum results. And we got numerous methods to arrive at making our point selections. We can use Zong Fu pattern identification. We can use a meridian systems approach, such as in the balance method and in the Master Dong system. And we can use Tong and Pulse and any number of other diagnostic procedures to arrive at deciding what points to use. Now, the thing about these fascial lines that make them so powerful is that we're arriving at our point selections based on anatomy and, more importantly, functional anatomy. So how these muscle groups work together and how this relates to joint movements and joint functions and the movement of the body. So this lateral line then, it looks like the gallbladder meridian. And there's a pattern that we recognize in Zong Fu, which is when the liver qi stagnation overacts on the lungs. That's a pattern, and we might use points like liver 3 and some of the lung points and some gallbladder points. But looking at this lateral line then, we see that the intercostal muscles here between the ribs connect to the transverse abdominis and then into the glutes and the IT band and down the gallbladder meridian. In the Master Dong system, we observe several groups of points on the gallbladder meridian or on this lateral line that are beneficial for lung conditions. So for instance, the 7 tigers down here by the ankle, which are between the gallbladder meridian and the bladder meridian, are used for lung conditions. And then there's points up here in the Master Dong system that are used for treating respiratory conditions as well. Well, looking at the anatomy of this line, that makes sense because when we put points here in the IT band, then through the principle of tensegrity, or the movement of qi, we could say, we're able to influence the intercostal muscles and the lungs because on the internal side of those muscles, we've got the parietal pleura and the lungs, and then there's going to be fascial attachments as well. And that's that internal-external connection. So many things about the traditional theories of the meridians and the internal-external relationships can be understood just by knowing the intricacies and the simplicity of the anatomy of these lines. Let's take a look at a few more here. So this is the deep front line, and the deep front line explains many things about the leg yin meridians. So one thing that is common for the leg yin meridians is that they treat gynecological conditions. So you can use points like liver 3, spleen 6, even spleen 7, spleen 8, spleen 9, that whole line. You can use liver 8, you can use kidney 6, kidney 7. All of these major leg yin points are used for treating gynecological and pelvic conditions. So on the deep front line, when we needle those leg yin points, we're going to be affecting this deep front line, and it includes the tibialis posterior. So when you do points from spleen 6 to spleen 9 and you get your needle depth and angle right, then you're going to be able to influence this whole myofascial chain here. So it makes sense when we look at this because the deep fascia and structures in the pelvis are all a part of this deep front line. So when we needle the points down here, like we spoke of, all of our traditional points that we use for urinary conditions, gynecological conditions, and pelvic conditions, by needling these points, we're having a direct anatomical and mechanical effect on these deep structures. Now, also included on this line is the diaphragm, visceral fascia, so the fascia that covers the organs. And that's another reason and way that we can understand how the leg yin points on the leg are so powerful for many kinds of internal conditions. Here we have the spiral line. I'm not going to talk a lot about that right now, but it does explain some things in regards to doing contralateral kneeling or kneeling on the opposite side of the body. And then over here we have the functional line, and this explains a lot about how points like Yao Tong Shui work and why we can use a lot of points on the hands to affect the back. So that's all I want to say about that for now, but let's go ahead and take a look at the arm lines. So here we see the superficial front arm line, and this crosses through the area of the lung meridian, the pericardium, and then the heart meridian as well. And then we can see that the latissimus is actually a part of this line as well. If we look at the image here, we can see the latissimus attaching down here to the back of the pelvis, and then the pectoralis major is also a part of this. This is the deep front arm line. We can see that it includes the bicep and then the points, the Hussey points on the arm yin meridians. And then over here we see the superficial back arm line, which includes the trapezius and the deltoids, and then the forearm extensors. And one thing I want to draw your attention to here, this explains a lot of the similar functions between the large intestine and Sanjiao meridians. So we'll use the large intestine and Sanjiao meridians for external invasions. So if it's wind heat, we'd use like Sanjiao 5. For wind cold, we could use Li4. But then we'll also use Sanjiao and large intestine points for digestive conditions as well. So Sanjiao 6 is an empirical point for constipation, and then we've got our large intestine points for conditions of the colon. And then this also helps us to better understand why we can use points like Luo Jian and Sanjiao 3 for treating neck pain. So there's many things that can be understood about the point functions when we ground our knowledge in the anatomy. Over here, this is the deep back arm line, and we can see that it looks a lot like the small intestine meridian. So small intestine 3 would be right here, which is the command point and the confluential point for the Du meridian. So we can see that included on this line are the levator scapulae and then the rhomboids, which have these major attachments to the spine in the thoracic and cervical area. So here again, we have another example of how we can trace the functions of these points through the anatomy and through the functionality of these muscle groups. And this gives us a better handle on knowing how to proceed with our treatments. So if you ever use Luo Jian and Sanjiao 3, which is a great point combination for treating neck pain, a lot of times you'll get really good results with that. Luo Jian and Sanjiao 3 on the opposite side of the pain does wonders, especially for acute conditions. Now, for more chronic conditions, you'll find in your clinical experience that it may give some benefit, but just a little, or maybe only temporary results. So you need to use other points. And for a lot of years, I struggled with, well, why does Luo Jian and Sanjiao 3 as a point combination work so well for treating neck pain for some clients, but not for others? And it took me years to understand that it was the acute conditions that typically responded better, and then the more chronic ones didn't respond so well, but sometimes they did and sometimes they didn't. So I had to develop my point progressions and what point group was I going to use if that point didn't work. And it was only through understanding these myofascial lines and the different levels that these lines are at that I got a better handle on how to progress through a treatment strategy and what to do if my initial point selections didn't work. And this is a really important thing to consider, because if you have a client and you do a group of points on them and they don't work, then don't do those points the second time they come in, because it's very unlikely that you're going to get a different result. So what you need to do then is understand how these points relate to the anatomy and start to isolate your points so that you're not using points that don't work. So for conditions that are at a deeper level of the neck and the spine, a lot of times you're going to get a better result by using a point like SI3 because it's going to affect these deeper level structures, whereas the Sanjiao and large intestine points are just going to affect the more superficial levels. So test that out clinically. The other thing you got to understand though is just doing small intestine 3 is not enough. And this is why I like the Master Dung system and talk about it in the 201 course as well, is because in the Dung system, they don't just do SI3 for neck pain. They would do SI3 and then a point just proximal to it. And they'll use what they call a Daoma, which is a group of 2 or 3 points, often on the same meridian or in the same body region. So if you use small intestine 3, which is known as 22.08 in that system, and then 22.09 together, you've got these 2 points that are close together on the hand. They have a powerful effect for treating a lot of spinal conditions, and not just of the neck and the thoracic area, but also of the lumbar area, and then the SI joint can also be benefited from this. But you need to understand the anatomy of this to really appreciate how these points can work on distal areas, even if those areas aren't included on these myofascial lines. Okay, let's take a look at some of the other slides here. So some of the benefits of knowing the fascial lines is that it provides a strong basis for making better point prescriptions. The fascial lines are an anatomical foundation for understanding the meridians and acupuncture points. When you don't get clinical results with your first point selections, knowing about the fascial planes helps guide us to the next logical selection. Okay, so understanding the anatomy of these lines, it takes a lot of the guesswork out of acupuncture. And even though I had practiced acupuncture for 14 or 15 years before learning about these fascial lines, and I'd done a lot of different methods. I'd done TCM for a lot of years. I'd done the balance method. I was very familiar with Dr. Tan's 6 systems. I'd done Japanese styles. I was still often confused about how I should progress through my point selections over the course of numerous treatments, or how I should progress to new points if my first choices didn't work. Now, through understanding these lines, I can confidently make better point selections and get better results and take the guesswork out of it because I'm establishing my choices in the anatomy and the functional anatomy of how these muscle groups work together. There's one more thing I want to show you here. This is the deep front line, and in my courses we go through detail of all these fascial lines. We talk about all the muscle groups. We talk about how they relate to other fascial lines, how they relate to the meridians, how they relate to the traditional meeting points. So here you'll see this image of the deep front line, and it includes the tibialis posterior and the long toe flexors. So the muscles that are involved in flexing the toes are a part of this line, as well as tibialis posterior. And then the fascia of the popliteus and the knee capsule is a part of this line, as well as the adductor muscles, the magnus and the minimus here on the inner thigh. So going through the anatomy and just understanding these components here that I've outlined will give you a lot of insights about how those leg yin points work. As an example, I want to show you something here. This is really important to consider and reflect on. We can talk about a region of points here between spleen 6 and spleen 9, and they'll have certain distinct effects. So in the Master Dung system, they call these point groups the 3 emperors, and it consists of 3 points between here, spleen 9 being one of them, spleen 7, and essentially you can take any 3 points from spleen 6 and spleen 9 and needle them as a Daoma, as a group on one leg, and get incredible results for urinary conditions, kidney conditions, reproductive disorders, and gynecological conditions as well, because these points are going to be affecting the pelvis. Okay. Now, spleen 6, as we know, is contraindicated in pregnancy. So Spleen 10, in some regards, is similar because it's a spleen point, but it's also known to move blood. But spleen 10 isn't contraindicated in pregnancy. And this is one thing that I considered for a long time and I could never really understand. And I asked a lot of my teachers, why is spleen 6 contraindicated in pregnancy but not spleen 10? Well, one way that we can look at this is that when we needle more distal points on these fascial lines, they tend to have a stronger effect overall systemically, but then also on the head and neck. So points on the hands and the feet are really good for treating facial conditions and conditions of the head because there's a lot of neurological endings there, so it's going to elicit a stronger neurological response. But then a lot of the points around the ankles and wrists are also very powerful. Spleen 6 being one of them, lung 7 is another, UB60 is another. So these points then that are located around the wrists and ankle, they have a really strong result systemically, and this relates to the way in which these fascial lines start to converge in this area. So all the tension that is held in the system, and there's this principle of tensegrity, which is essentially the study of how tension moves through these fascial lines. So when there's this neuromuscular convergence occurring down here around the hands and the feet, and these fascial lines are converging in this area, then they'll tend to be able to release tension and move things very powerfully in the body. Okay, so I think that's a partial explanation for why spleen 6 is contraindicated in pregnancy. And the rest of that has to do with the way that the spleen 6 point has a direct connection to the deep pelvic structures. Okay, now as we come up the line, though, the points don't tend to respond so powerfully. So you've probably noticed that in your patients. You get a stronger needle reaction in the hands and the feet, and certainly at the more distal parts of the legs and the arms. They give a strong needle reaction. But if you needle points like on the thigh or up on the upper arm or on the torso, they don't give that strong sensitivity reaction like the more distal points do. And that has to do with the nervous system, and it has to do with the way in which the tension converges through these fascial lines around the wrists and the ankles. So when you do a point like spleen 6, it powerfully influences this whole deep front line, but then it's also going to have neurological effects as well. But when you come up to a more proximal point like spleen 10, it's not going to have such a strong neurological and myofascial effect. Now, certainly it will have some benefits, and I love needling that point, and I frequently do. But the other thing to consider here is that spleen 10 is on this superficial front line. So spleen 10 is not going to have so much influence on these deep internal structures like spleen 6 does. So this is really just a shortened explanation for the dynamics that occur here, but I hope that you can come to see that by needling points from spleen 6 to spleen 9, when you get your needle depth and angle right, you can have really strong effects on this whole deep front line. But the spleen points from spleen 10 to spleen 12 are on the superficial front line, so they're going to have a different result. Now, we can still use them for the gynecological conditions and the things that we do, but they're typically not so strong as the points from spleen 6 to spleen 9 when it comes to benefiting the pelvic area. Now, one final thing I want to say about this is in the dung system, they'll use these points 88.09 to 88.11, which is essentially just in this spleen 10 to spleen 12 region. So here on the thigh, on the superficial front line, they'll use these points for treating clavicle pain. So you can imagine if you put in a point like spleen 10, spleen 11, spleen 12, if we follow this fascial line up, it's going to influence the clavicle as well as the SCM. So I think that's why these master dung points in this area are used for clavicle pain, because they're on this same fascial line. So I hope you've gotten something from this and can start to apply this clinically. In my 201 course, I go into great detail with all these fascial lines and all the major meridian points. We talk about a whole lot of other things that aren't included in this, and I guarantee that you'll be able to increase your clinical skills dramatically and very quickly if you assimilate this information and really take it in. So looking forward to hearing from you. If you have any questions or comments, feel free to write me at any time. I like having conversations with people, and I like discussing this material and doing everything that we can to get people better.